So this was a multi-center study where that same regimen, which is familiar to most practicing oncologists, was given to patients with adult Burkitt lymphoma, irrespective of whether or not they had HIV, irrespective of their age, irrespective of their disease stage, and irrespective of whether or not they had involvement in the central nervous system. So a very broad representative patient population. So this was 22 centers across the United States only, and 113 patients were included. So Burkitt lymphoma is not very common. There's only like 1,200 cases a year, so 113 patients over a 5 to 6 year period is pretty good and pretty representative. So what that study has shown us is that if you look at all patients, the event-free survival at 3 years is 85%. That means most patients are cured with this regimen. In fact, it's possible that even more patients are cured with this approach than intensive therapy. If that's true, it's probably because they can get through the therapy. If you look at subgroups, so if you look at things like HIV status, it doesn't matter, same outcomes. If you look at age, same outcomes. So we broke it down by patients under the age of 40, 40 to 60, and over 60. And there was no difference in outcomes. They were the exact same. In fact, this treated patients all the way up to age 86. Another important part of our study was there's a group of patients with Burkitt lymphoma that have a highly proliferative tumor, but it's quite localized. So we would consider this low-risk Burkitt lymphoma. On our study, those patients got only 3 cycles of chemotherapy, and all those patients were cured. There was only 14 patients, but to be able to cure Burkitt lymphoma with 3 cycles of chemotherapy and that's it is certainly relevant to the way we approach this. The other patients got 6 cycles. Okay, so they got 6 cycles, and they came in around 83%.